I am talking from the field perspective because I am a field veterinarian and I am into companion animal practice. So healthy animals are equal to healthy us. So it's something that I feel deeply that we should, as veterinarians, take our precautions. So we are living in an interlinked world. So how did the interlinking happen? So interdependence has actually been happened because of domestication. So man domesticated a whole lot of species led by cattle for agriculture, pigs, goats, dogs and cats because he wanted some kind of solace, horses for fast transportation, sheep, etc., etc. So the chief reasons are basically man. Man decided that he wanted these species for his own well-being. Obviously, like we had diseases, the animals also had their own diseases, and over time, zoonosis was the result of this interdependence. You will be surprised that reverse zoonosis is also possible. For example, tuberculosis is very widely rampant in human beings. We end up giving it to human beings. So this I have seen in my own practice where dogs have developed tuberculosis when they have been in contact with a pet owner who also had tuberculosis. And then the recent SARS, swine flu, bird flu, COVID, right now monkeypox. So all of these have been a reason of this interdependence. One major drug which really man has created havoc in the vulture population was diclofenac sodium. We managed to wipe out the entire species of diclofenac by just introducing this anti-inflammatory drug to treat the pain of a bovine cattle. And the vulture would go and try to eat that animal and the residue will kill the vulture. So we have managed to. So there is a huge footfall. Now we are trying to improve it by trying to revive the vulture population. In my own clinic and in a lot of clinics in Bombay, we try to follow the guidelines that have been recommended with the antimicrobial. Every clinic, we try to have an antimicrobial policy. It's not in a big scale, but we do try it. The other thing when we talk of companion animal practice is there is a lot of emotion attached to the pet, and there is always a urge from the small animal practitioner to go beyond. So when we do a culture sensitivity test, we find most of it is resistant, and the only ones which are working are the imipamines, the linezolid, and all the higher antibiotics. So we are being forced on a veterinary scale, on a world scale, the veterinarians are working to not use human antibiotics to treat pet patients. So an antimicrobial, we should use one meant for the animal species. And the other thing is the impact of drug residues. Veterinarians need to optimize the dose, the duration, the method of administration of the antimicrobial agent. I've lost this here. So a strict adherence will go a long way in ensuring a successful coexistence between our world and the animal world. And the other important, like a lot of my previous speakers have spoken, is about the environment and how we need to contribute more. No plastic, like the first speaker was talking about cattle eating plastic. So these are all not good. Like even if you go fishing, then they are finding fish in the deep sea with plastic residues. So these are something that man has to take a lead. So this is a study that has been done with the leadership of Dr. Bhushan Jairao, who is an epidemiologist, and the Penn State University. So they contacted the Pet Practitioners Association of Mumbai, and this study was done, practice and perceptions of antimicrobial stewardship of the small animal practitioners in Mumbai. So this, So coming to this is we didn't start the fire. So the study basically is looking at who is who, that is talking about the demographic of patient of our veterinary doctors in Mumbai. The Act 2 will talk about the dispensers of antimicrobials, the antimicrobial use and stewardship, and the third is I have a dream, perceptions of antimicrobial resistance. What the doctor feels is his perception of antimicrobial resistance. So this is basically the field practitioner's view. So the purpose of the study, we felt as part of the executive of the Pet Practitioners Association that the veterinarians are the guardians of antibiotics and how we use them into our companion animal practice. So our antimicrobial stewardship is vital for the successful outcomes and reducing the risk factors associated with AMR. AMR is being antimicrobial resistance. This prudent use is influenced mainly by the knowledge, the attitudes, and most importantly, the perceptions of AMR. This knowledge part is something that is very age-related. Like, for example, veterinarians before me had only the knowledge of streptopenicillin as a choice of antibiotic. By the time I graduated between 88 to 95, our antibiotics were ampicillin and cloxacillin. After 2000, every graduate who comes out of our college, you ask him which is his first choice of antibiotic, then it is getting hit as fluoroquinolones. So that is where the knowledge and the attitude is a very key factor. So our comprehensive study was conducted to assess these factors in the two big districts. One is Mumbai and the adjacent district, which is Thane. And we share our findings in this small study. This is a part of a big study that was done and a very small that I am presenting now. So this was very aptly put forward by Dr. Girding. The optimal selection, the dose, and the duration of the antimicrobial treatment that results in the best clinical outcome for the treatment or prevention of infection with minimal toxicity to the patient and minimal impact to the subsequent antimicrobial resistance. So like somebody said, the resistance is the shadow. So this is basically, we have to be very aware of what is happening. So one is the preventive. So we vaccinate our pets, and the other thing is the biosecurity and infection control. So we have hospitals and there are kennels. And so how do we keep those kennels clean? How do we use the Lysols and all the other antibacterial agents inside our kennels? And how do we reduce the spread of infection? And the third is the nutrition. How do we improve the nutrition of our pets, cats, dogs? I'm talking of dogs and cats because I'm representing this population. And how do we take the overall health of these animals? The second is evidence-based. So how do we judiciously use the medicines which are available to us? So we should be using all the diagnostic tests. Do we talk about a gram stain? Do we do a culture? Do we do an aerobic culture? Do we do an anaerobic culture? So what is it that we are using? And then are we selecting the drug based on the correct antimicrobial that is supposed to be used for that particular disease? The other thing that we have found is most of us are using, veterinarians are not using they choose the antimicrobial, but we are not using it at the correct dosage. So that is the other problem that we have mentioned. And then how do we monitor the outcome? So evaluate the outcomes of the antimicrobial treatments and adjust the protocols as needed. So we do it for 5 days, do we do it for 7 days? Like, for example, when we started doing a lot of our continuing education and we had foreign experts come in, so skin is the biggest organ in the body of a dog. They would say, okay, treat for 1 or 2 weeks ahead of a clinical cure. So now that became 4 weeks. Now again it is getting reduced to 1 week. So what is the duration of the treatment that we need to do? The other is client education. So it's like the TB treatment. The guy is supposed to take the medicine for 9 months or a year. He ends up taking it for 5 days. So our pet owners would end up giving their medicines for 3 days. Because he thinks the dog is better, he stops the medicine. The other problem is medicating the dog or cat. It's almost impossible. So we have to engage our clients, working with the clients to implement the preventive measures. And like for example, if you talk to a veterinarian and you say, my dog is having diarrhea, the first drug that the guy will throw out to you is Metrogyl, without any evidence that the diarrhea is caused by a bacteria. Here we end up giving metronidazole to a dog or a cat. So this is something that we are very common. I have been guilty of this myself. So the survey design was a comprehensive 3-part online survey. So we started with 313 respondents, and then out of which we had 241 which were correct addresses, and then some people dropped off. So at the end of the study, we had about 79 respondents who we were able to get proper feedback from. So this has been, the responses were collated, categorized, and exported as an Excel sheet by using the JMP statistical software. So Penn State uses this software. So we did the first, send out the email, then we did a follow-up email, we did the phone calls, and the end of it is where we study. So we didn't start the fire. So now we are talking about the demographics of the participants. So we had a very big group between the ages of 18 and 40 and up to 50. So our generation of practitioners is a very young generation. And as you can see from the study, it's almost equal male and female. Okay, 50% male and 46% female. I'm sure it's 50-50, maybe even more. So the other thing is that the gender and the graduation cohort. So we had a lot of, if you see the graph, in 71 to 80, there were no females. The first veterinary girl who came out was somewhere in 1965. And then 1981 to 1990, the ladies grew in the profession. To follow it up with up to 2020, now we have 80% women in the profession, and that is only going to increase. And as similarly with the gender and years of experience. So this is what I said. So most of us were in self-owned establishments where we were operated from a residential house or a commercial house, and most of us work with dogs and cats. Now almost 25% of the Bombay veterinarians are working with exotic species like fishes and rabbits and guinea pigs. And this is, when asked to describe their practices best, most of us are general practitioners now going into specialty practice. Now coming to the dispensers of antimicrobials, the antimicrobial use and stewardship. So this is how we are looking at it. So the AMR stewardship benchmark is greater than 90% of the responses. Now when we ask how often do each of you follow these practices, we find how significant people are providing clientele with written protocols for antibiotic use. But there is almost a 25% people who don't provide any protocol. A majority people do initiate the conversation with pet owners about antibiotic use. And again, a majority of them also initiate the regular protocol with their own staff. That means, do we do an antibiotic for 5 days? Do we do an antibiotic for 14 days? This is discussed with the staff. And also, this is the important thing where we need to get up, we need to start disseminating the educational materials that is available with us. And also we need to keep written computer records of the antibiotic use. So 43% did not provide any antimicrobial use. Okay, 26% like I said, and this is what I just said. 30% are not keeping any records, not good. And 54% may or may not use bacterial culture to confirm the antibiotic selection. 38% may recommend use of antibiotics in feed. So 90% is our standard. So Bombay and Thane are not reaching up to this. Now I have a dream. What is the perception of antimicrobial resistance? So is this a major area of concern? Yes, majority of people strongly agree with it. Should be a concern for all veterinarians? Again, a majority of the group is agreeing to it. is a major concern for the clientele. Again, majority of our practitioners interviewed have said this. Is it a major concern for general public? Yes, again, that group is all saying yes to most of this. What they are saying is, does it require further research in livestock? Again, so all the answers are yes on this. So is AMR an occupational hazard? Yes, and 13% of the respondents indicated they are sure or strongly disagreed with the statement that AMR will harm human and animal health. And this is the other part where they say 19% of the respondents agreed with the feeding antibiotics to improve feed efficiency, 35% were unsure of this practice, 52% would allow the use of antimicrobials to prevent disease in animal species, 81% were not in favor of allowing livestock owners to use antibiotics. People who are in the field will understand that the livestock owner ends up giving antibiotics himself.
So, Dr. JAIRAM, your time is...
1 minute.
Yeah.
When asked about AMR in humans, 75% of the respondents stated that the use of antibiotics to prevent disease, over-the-counter sales of antimicrobials had a substantial role in AMR. And this is, we must take action to, this is the spider's web, we must take action to minimize antibiotic resistance as there is potential to cause harm. So this was an important thing for us where I organize a lot of continuing education. So have you attended any continuing education program with relation to antimicrobial resistance? The answer is we have not organized that many. So majority would be have not attended. And this is the preliminary finding. Significant number had positive perceptions. Recommendations include maintain records on antimicrobial use, including perceptions, and attend CE on antimicrobial resistance to receive updates on the emerging resistance trends in humans, animals, and wildlife. Thank you.
So thank you. Thank you.